So is your penis hiding? How do you get that thing to come out and enjoy the sunshine? Hey guys, it's Doc Heps here. And so the question we're going to go over today is buried penis. Lots of men, especially big guys, may have their penis that's kind of engulfed by this tissue around their pelvis, or they notice that their penis just kind of has shrunken away. Well, I'm going to tell you what that is all about. We'll go over some of the diagnosis, why this happens, and some of the treatment options. So, what is a buried penis? It has other names. This is called a hidden penis or a turtling penis. Basically, it typically occurs in guys who are big, overweight. And what happens is, as you gain weight, you increase the fat that's in your pubic area. And really what happens is the penis doesn't necessarily get smaller, but where you carry your weight just enlarges, and it kind of engulfs, that tissue engulfs the penis. So it's basically buried in that tissue. The reasons this could happen is there's some obstruction to the lymphatic flow. Lymph is a channel system that drains the excess fluid in our legs. So if there's some sort of abnormal blockage to that system, which can happen in surgeries and different conditions, that can cause that tissue to grow over in the pelvis and the penis and cause a buried penis. In a lot of guys who used to be big but lost a lot of weight, there's excess skin folds that basically covers up the penis and causes this buried penis condition. So what kind of problems can this cause? Well, it can get you down. It can cause depression. It can cause relationship issues. It can cause erection issues. You can have different urinary problems because the skin of the penis can't stay dry. You can have urethral scarring and different issues with voiding, such as a weak stream, and different dermatologic conditions of the skin because that penis, the skin of the penis is caught underneath that excess tissue. What can you do about it? Well, some of the treatment options are address the underlying issue, try and lose weight. Oftentimes, that's just not a viable option, and many men will have this buried penis, and they'll have different problems with urinary tract infections or skin infections. So another option can be going to what's called a reconstructive urologist. There are special urologists that focus on reconstructing that suprapubic area. And oftentimes they may work with plastic surgeons to resect that excess tissue. And so there's different procedures that can be done to excise that excess tissue that has sort of engulfed and buried that penis, and you can have a more functional, normal anatomy. And that's a real option for some guys. So just to briefly go over in summary, buried penis is a relatively common condition, especially in men who are overweight. Really, it's not a problem of penile length. It's just that the tissues have grown over the penis because of where you carry your weight. Diagnosis is just made by an exam, and the things that it can cause is urinary tract infections, functional difficulties with sex and depression, which are significant and significantly affect the quality of life of you. And oftentimes the most effective treatment can be a surgery that a specialized reconstructive urologist can help with. Alternatively, some guys are just wondering what's going on, and if it's not a problem, we just leave it the heck alone. Don't do anything. So if this is a problem that you might have, I would say talk to your urologist, see if he can offer one of these options. At least he can get you to the right person who may have some expertise in that area if you were to consider surgical treatment. So I appreciate you watching the video. Hopefully this provided some help into what's going on and for you to understand this problem. I appreciate you checking out our other videos. Thanks again.